So I provide services to anybody who has a uterus, anybody who has something going on inside their uterus that they want help with, or that they want they want to change, or that they want to continue. Like, say somebody needs birth control. I love helping out people find and plan their families the way that they want to have a family or not. I love helping families as they go through pregnancy and delivery and labor and all the way into postpartum, and getting to see those families as they are starting to gel as a family together in the postpartum period. It's really cool. I help with breastfeeding, and I also help with life care all the way up until menopause, and even beyond menopause, to make sure that we are tracking whether you've got any problems going on like cervical cancer, or doing screenings or STI testing, just about anything for a person that has a uterus. A typical visit with me starts off with getting to know each other, especially if we're going to be doing any kind of exam, because there's nothing more uncomfortable than meeting somebody and being like, "Hi, I'm Amy, please show me all of the private business that you have going on." That's just not nice. So we're going to get to know each other pretty well before we do any kind of exam. I want to know why you're here. What can I do to help you? What worries do you have? What questions do you have? So that we can get a plan together even before we do any kind of investigating. I love being able to form relationships with my patients. I love being able to, let's say, see somebody for their annual exam, their pap smear, for a couple of years in a row, and then they decide that they want to expand their family. They decide that they want to have a baby, they become pregnant. I get to track with them through their whole pregnancy, get to meet that little person that's kicking at us during the prenatal visits, and then get to see that family flourish with breastfeeding, bottle feeding, whatever they want to do, and make sure that that family is doing well as we send them on into the rest of their lives together. And then get to see pictures of kiddos as they get a little bit older at those annual exams continuing on. Extraordinary care every day really means to me that I'm going to treat every single person that I interact with as if they are my sister, my mother, my daughter, somebody that I care deeply about, and that I want to make sure that they have the best possible care. That's extraordinary care every day to me.